Welcome to our comprehensive guide on understanding patient support and care. In today's healthcare environment, patient support goes far beyond just medical treatment. It involves a holistic approach that addresses emotional, psychological, and practical needs. Whether you're a healthcare professional, a caregiver, or someone interested in the topic, this video will walk you through the essential elements of patient support and care. We'll explore what it means to truly support a patient, the roles of different caregivers, and how compassion and communication play a vital role in the healing journey. Let's begin by defining what patient support really means. Patient support is more than just providing medical care. It's about creating an environment where patients feel heard, respected, and valued. Support can come in many forms, from offering a listening ear to helping with daily tasks or providing information about treatment options. The goal is to empower patients, helping them navigate their healthcare journey with confidence. By understanding patient support, we can ensure that every individual receives care tailored to their unique needs, fostering trust and improving outcomes. Compassion is at the heart of patient care. It's the ability to empathize with a patient's situation and respond with kindness and understanding. Compassionate care can make a significant difference in a patient's experience, reducing anxiety and promoting healing. Healthcare providers who show compassion help build a strong therapeutic relationship, making patients feel safe and supported. This emotional connection is just as important as the physical aspects of care, and it's something that every member of the healthcare team can contribute to. Clear and open communication is essential in patient support. Patients need to understand their diagnosis, treatment options, and what to expect during their care journey. Healthcare professionals must listen actively, answer questions honestly, and provide information in a way that's easy to understand. Effective communication helps prevent misunderstandings, builds trust, and ensures that patients are fully involved in decisions about their care. It's a two-way process that requires patience and empathy from both sides. Emotional support is a crucial aspect of patient care. Facing illness or injury can be overwhelming, and patients often experience fear, anxiety, or sadness. Providing emotional support means being present, offering reassurance, and validating a patient's feelings. Sometimes just having someone to talk to can make a world of difference. Healthcare teams, family members, and friends all play a role in offering this kind of support, helping patients cope with the emotional challenges of their health journey. Beyond emotional support, patients often need practical help with daily activities. This can include assistance with mobility, personal hygiene, meal preparation, or managing medications. Practical support ensures that patients can maintain their independence and dignity while recovering or managing a chronic condition. Caregivers and healthcare professionals work together to assess each patient's needs and provide the right level of assistance, always respecting the patient's preferences and privacy. Family members are often a vital part of the patient support system. They provide emotional comfort, help with decision-making, and assist with daily care. Involving family in the care process can improve outcomes and ensure that patients feel surrounded by love and understanding. Healthcare teams should encourage family participation, offering guidance and resources to help them support their loved one effectively. Patient care is a team effort. Doctors, nurses, therapists, social workers, and other professionals collaborate to provide comprehensive support. Each member brings unique skills and perspectives, working together to address the physical, emotional, and practical needs of the patient. Effective teamwork ensures that care is coordinated and that nothing falls through the cracks. Patients benefit from this collaborative approach, receiving well-rounded support throughout their healthcare journey. Advocacy is an important part of patient support. Advocates help patients understand their rights, navigate the healthcare system, and make informed decisions. This can involve explaining complex medical information, assisting with insurance issues, or ensuring that a patient's wishes are respected. Advocacy empowers patients, giving them a voice in their care and helping them achieve the best possible outcomes. Cultural sensitivity is essential in patient care. Every patient comes from a unique background, with their own beliefs, values, and traditions. Healthcare providers must respect these differences and adapt their approach to meet each patient's needs. This might mean accommodating dietary restrictions, understanding cultural attitudes toward illness, or providing care in a preferred language. Culturally sensitive care builds trust and ensures that all patients feel respected and understood. Education is a powerful tool in patient support. By providing clear, accurate information about conditions, treatments, and self-care, healthcare professionals empower patients to take an active role in their health. Patient education can include one-on-one discussions, printed materials, or digital resources. The goal is to ensure that patients understand their options and feel confident managing their care, leading to better health outcomes and greater satisfaction. Supporting patients with chronic illnesses requires ongoing care and attention. These patients often face long-term challenges that affect their daily lives. Support includes regular monitoring, medication management, lifestyle advice, and emotional encouragement. By building strong relationships and providing consistent support, healthcare teams can help patients manage their conditions effectively and maintain a good quality of life. Acute care involves supporting patients during sudden or severe health events such as injuries or surgeries. This type of care is often fast-paced and requires quick decision-making. Support includes pain management, monitoring vital signs, and providing reassurance to both patients and their families. The goal is to stabilize the patient and guide them through the recovery process with compassion and expertise. End-of-life care is a sensitive and important aspect of patient support. It focuses on providing comfort, dignity, and emotional support to patients and their families during the final stages of life. This care includes pain management, spiritual support, and helping families cope with grief. The aim is to ensure that patients experience peace and respect in their final days, surrounded by compassionate caregivers. Mental health is a vital part of overall well-being. Patients dealing with mental health challenges need support that addresses both their emotional and practical needs. This can include counseling, medication, and connecting patients with community resources. By treating mental health with the same importance as physical health, we can help patients achieve better outcomes and improve their quality of life. Children require special consideration in patient support. Pediatric care involves not only treating the child's medical needs, but also supporting their emotional development and involving their families in care decisions. Creating a child-friendly environment using age-appropriate communication and offering reassurance are key elements. Pediatric support helps children feel safe and understood, making their healthcare experience as positive as possible. Older adults often have unique healthcare needs. Geriatric patient support focuses on maintaining independence, managing multiple health conditions, and preventing complications. Support may include help with mobility, medication management, and social engagement. By understanding the challenges faced by older patients, caregivers can provide compassionate, respectful care that enhances quality of life. Discharge planning is a critical part of patient support. It involves preparing patients to leave the hospital and continue their recovery at home or in another care setting. This process includes providing instructions, arranging follow-up appointments, and ensuring that patients have the resources they need. Effective discharge planning reduces the risk of complications and helps patients transition smoothly to the next phase of care. Many patients receive care at home, either after a hospital stay or as part of managing a chronic condition. Home care support includes nursing visits, physical therapy, and assistance with daily activities. It allows patients to recover in a familiar environment while still receiving professional care. Home care teams work closely with patients and families to create personalized care plans that meet each individual's needs. Technology has transformed patient support. Telehealth and virtual care allow patients to connect with healthcare providers from the comfort of their homes. This can include video consultations, remote monitoring, and online education. Virtual support increases access to care, especially for those in remote areas or with mobility challenges. It's a convenient and effective way to provide ongoing support and maintain communication between patients and providers. Support groups offer patients a chance to connect with others facing similar challenges. These groups provide a safe space to share experiences, offer encouragement, and learn coping strategies. Whether in person or online, support groups can reduce feelings of isolation and empower patients to take control of their health. Healthcare providers often recommend support groups as part of a comprehensive care plan. Community resources play a vital role in patient support. These can include transportation services, meal delivery, financial assistance, and access to social services. By connecting patients with community resources, healthcare teams help address practical barriers to care and improve overall well-being. Patients who feel supported by their community are more likely to follow treatment plans and achieve better health outcomes. Healthcare costs can be a significant burden for many patients. Financial support may include help with insurance, payment plans, or connecting patients with charitable organizations. By addressing financial concerns, healthcare teams reduce stress and allow patients to focus on their recovery. Financial counselors and social workers are valuable resources in helping patients navigate these challenges. Proper medication management is essential for patient safety and effective treatment. Support includes educating patients about their medications, helping them organize doses, and monitoring for side effects. Pharmacists, nurses, and caregivers all play a role in ensuring that patients take their medications correctly. Good medication management reduces the risk of complications and improves health outcomes. Nutrition is a key part of recovery and overall health. Patients may need guidance on healthy eating, managing dietary restrictions, or accessing nutritious meals. Dietitians and nutritionists work with patients to create personalized meal plans that support their health goals. Good nutrition helps patients heal faster, maintain strength, and prevent complications. Physical therapy helps patients regain strength, mobility, and independence after illness or injury. Therapists design exercise programs tailored to each patient's needs and abilities. Support includes encouragement, progress tracking, and adapting exercises as needed. Physical therapy is an important part of the recovery process, helping patients achieve their best possible outcomes. Occupational therapy focuses on helping patients perform daily activities and maintain independence. Therapists assess each patient's abilities and develop strategies to overcome challenges. Support may include adaptive equipment, home modifications, and training in new skills. Occupational therapy empowers patients to live as independently as possible, improving their quality of life. Rehabilitation services are essential for patients recovering from serious illness or injury. These services include physical, occupational, and speech therapy, as well as psychological support. The goal is to help patients regain function and return to their daily lives. Rehabilitation teams work closely with patients and families to set goals, monitor progress, and provide encouragement every step of the way. Managing pain is a key part of patient support. Pain can affect every aspect of a patient's life, from sleep to mood to mobility. Support includes medication, physical therapy, relaxation techniques, and counseling. By addressing pain effectively, healthcare teams help patients feel more comfortable and improve their overall quality of life. For many patients, spiritual support is an important part of healing. This can include access to chaplains, prayer, or connecting with faith communities. Spiritual care helps patients find meaning, hope, and comfort during difficult times. Healthcare teams should respect each patient's beliefs and offer support that aligns with their values. Ensuring patient safety is a top priority in healthcare. Support includes preventing falls, reducing infection risks, and monitoring for medication errors. Healthcare teams use checklists, safety protocols, and regular training to keep patients safe. Patients and families can also play a role by speaking up about concerns and following safety guidelines. Respecting patient privacy is fundamental to building trust. Support includes protecting personal information, ensuring confidential conversations, and respecting boundaries during care. Healthcare providers must follow strict privacy laws and policies to safeguard patient data. Patients who feel their privacy is respected are more likely to share important information and engage in their care. Empowering patients means giving them the tools and confidence to take charge of their health. Support includes education, encouragement, and involving patients in decision-making. Empowered patients are more likely to follow treatment plans, ask questions, and advocate for themselves. This leads to better health outcomes and a more positive care experience. Healthcare system can be complex and overwhelming. Patient support includes helping individuals navigate appointments, referrals, insurance, and paperwork. Care coordinators and social workers are valuable resources, guiding patients through each step and ensuring they don't feel lost or alone. This support helps patients access the care they need efficiently and confidently. Listening to patient feedback is essential for improving care. Support includes creating opportunities for patients to share their experiences, concerns, and suggestions. Healthcare teams use this feedback to make changes, address issues, and enhance the quality of care. Patients who feel heard are more engaged and satisfied with their care experience. Every patient has rights that must be respected. These include the right to informed consent, privacy, and access to care. Support involves educating patients about their rights and ensuring that these rights are upheld at all times. When patients know their rights, they can make informed decisions and feel confident in their care. Coordinating care across different providers and settings is crucial for patient support. Care coordinators help manage appointments, share information between teams, and ensure that care is seamless. This reduces confusion, prevents duplication of services, and helps patients receive the right care at the right time. Patient-centered care puts the individual at the heart of every decision. Support includes respecting patient preferences, involving them in planning and tailoring care to their unique needs. This approach leads to higher satisfaction, better adherence to treatment, and improved health outcomes. Patient-centered care is the gold standard in modern healthcare. Advancements in technology have revolutionized patient support. Electronic health records, mobile apps, and wearable devices help track health data and improve communication. Technology makes it easier for patients to access information, manage appointments, and stay connected with their care teams. Embracing technology enhances the quality and efficiency of patient support. Patients may face barriers to receiving support such as language differences, transportation issues, or lack of resources. Healthcare teams work to identify and overcome these barriers, ensuring that every patient has access to the care they need. Solutions may include interpreter services, transportation assistance, or connecting patients with community organizations. Trust is the foundation of effective patient support. Patients need to feel confident that their healthcare team has their best interests at heart. Building trust involves honesty, transparency, and consistent follow-through. When trust is established, patients are more likely to engage in their care and achieve better outcomes. Patient support is always evolving. Healthcare teams regularly review their practices, seek feedback, and look for ways to improve. Continuous improvement ensures that patient care remains effective, compassionate, and responsive to changing needs. By embracing a culture of learning, healthcare providers can deliver the best possible support. Future of patient support will be shaped by new technologies, changing patient expectations, and advances in medical science. Personalized medicine, artificial intelligence, and digital health tools will play a bigger role. However, the core principles of compassion, communication, and respect will always remain at the heart of patient care. By staying adaptable and patient-focused, healthcare teams can continue to provide outstanding support. Let's recap the key points we've covered. Patient support and care involve a holistic approach that addresses physical, emotional, and practical needs. Compassion, communication, and teamwork are essential. Support comes from healthcare professionals, families, and communities and is tailored to each patient's unique situation. By focusing on these principles, we can ensure that every patient receives the care and support they deserve. Thank you for joining us on this journey to understand patient support and care. Remember, every patient is unique, and effective support requires empathy, respect, and collaboration. By embracing these values, we can make a meaningful difference in the lives of those we care for. Patient support is not just a responsibility, it's an opportunity to bring comfort, hope, and healing to those in need.